Good morning, everybody. My name is Dr. Eve Shepherd. I'm the anesthetic director in Hamilton Base Hospital. Thank you to our lovely midwives for inviting me today. So I'll be talking about pain relief in labor. And I'll focus on epidurals for labor in particular. So how commonly pregnant ladies request an epidural for labor? In Australia, it's around 30% of ladies would like to have an epidural for labor. To compare it with the UK, it's about 25% in there, and in America, around 66%. What is the actual mechanism of pain relief? So we will site a small plastic tube in your lower back, very close to your nerves in your lumbar area, and via this catheter will keep injecting some mixture of local anesthetic and strong painkiller, usually an opioid, and this will numb the nerves that carry the pain from the birth canal to the brain. The side effect of this numbness could be weakness of your legs, and it all depends on the local anesthetic we use and the amount of local anesthetic we use as well. In some hospitals, we have so-called walk-in epidurals policies. This policy is not implemented in our hospital just yet. So when you are having your epidural in here, you would be asked to kindly rest on your bed. An anesthetist is the only doctor who can give an epidural, and after it has been sited, we have to monitor your baby's heartbeat throughout the labor. What we set up for, when we set up for an epidural, we also site an IV cannula at the back of your hand, some local anesthetic, so it's not that painful. We will ask you to be in your sitting up position, preferably, and the whole procedure usually takes around 20 to 30 minutes. After it's been sited, it takes another 20 minutes till it gets the full effect. We will be monitoring your blood pressure throughout quite frequently, around 5 minutes, in about 5 minutes intervals. And as I mentioned before, we will monitor your baby's heart rate. After you've had your baby, we'll just pull that epidural out and we'll check the site whether there are no signs of infection. You might want to ask, when can I have an epidural for labor? There are a variety of factors that will determine the timing. Sometimes in patients with comorbidities, we put so-called early epidural for labor, especially for patients with pregnancy-induced hypertension or in patients with preeclampsia. But if there are no contraindications, you can request an epidural at any stage during your labor. Quite important information is that an epidural for labor has no effect on the risk or incidence of cesarean section, and it has been scientifically proven. Even though siting an epidural is a very common and safe procedure, these are some possible problems which can occur. So repeated top-ups may cause temporary leg weakness, and it does increase the risk of forceps or venous delivery a bit. An epidural insertion may slow down the second stage of your labor, and it may lower your blood pressure. It does lower blood pressure almost in every patient. It can cause itching and fever. And very important information is that backache is actually not caused by epidurals, but it is a very common situation during and after pregnancy. So this slide shows specific risks attached to epidural insertion. 1 in 8 patients with epidurals we are not very happy with, so we have to adjust it or even replace it. The risk of infection is 1 in 500,000 patients. There's a risk of bleeding, which is very rare, 1 in 170,000. There's a specific headache, which we call postural puncture headache, which can happen 1 in 100 patients, and it's well treatable. The nerve damage, severe nerve damage can happen 1 in 250,000 patients. And I haven't seen any patients with severe nerve damage in 25 years of my anesthetic practice. Good. So to sum it all up, epidurals do not have a negative effect on the baby. Epidural doesn't cause any back pain. It doesn't increase the rate of cesarean section. But on the other hand, it may prolong the second stage of labor, and it might increase the risk of instrumental delivery. Now, we will watch this video. It usually takes 8 minutes. It's a very good web page. It's called Labor Pains, and you can find some very useful information about cesarean sections there as well.
Pain relief in labour. Many women choose to have some form of pain relief in labour. There are several options, including gas and air, pethidine, and epidurals. Epidural and spinal injections are the most effective ways to relieve pain in labour. Both are performed by a doctor specialising in pain relief, known as an anaesthetist. There is always an anaesthetist on delivery suite 24 hours a day. An epidural is a special form of injection that allows the anaesthetist to place pain-relieving medicine around the nerves in your lower back, blocking the sensation of pain. The aim of the epidural is to take away the pain of contractions, but you may still feel a sensation of pressure during contractions, which is completely normal. In order to prepare for an epidural, your midwife will monitor your baby's heartbeat throughout the procedure. A thin plastic tube called a cannula is put into a vein in your hand so that you can have fluid to keep you hydrated. Epidurals cannot offer instant pain relief. It usually takes 20 minutes for the epidural to be put in and a further 20 minutes for the pain relief medicine to work. Because of this, if you have your epidural late in labour, the anaesthetist may also give you a different form of pain relief, called a spinal, at the same time. A spinal provides faster pain relief, whilst the epidural allows regular top-ups of pain medicine throughout labour. Bear with me for 5 to 10 minutes. Your midwife will ask you to sit forwards or curl up on your side, and she will clean your back with a cold antiseptic spray. Bending forward or curling your back is very important, as it helps the anaesthetist to find the right place for the epidural. The anaesthetist will then inject local anaesthetic into the skin of your lower back. This will sting to begin with, but it will quickly make the skin numb. This makes putting the epidural in more comfortable for you. The safety of you and your baby is very important. Your anaesthetist will ask you to keep still while the epidural is being put in. If you feel a contraction starting, you must tell the anaesthetist so that he or she can stop and wait until the contraction finishes. The anaesthetist will place a special needle into the numb area of your back. This allows a thin plastic tube called an epidural catheter to be placed near the nerves in your spine. You will feel this as pushing or pressure. This is normal, but if you also feel pain or tingling, tell the anaesthetist. Once the thin tube is in the correct place, the needle is taken out, but the epidural catheter will stay in place until after your baby is born. This catheter allows further top-up doses of pain-relieving medications to be given at regular intervals during your labour. Just let your midwife know when you need them. Your midwife will take your blood pressure regularly after your epidural is topped up. Some women prefer to have some feeling during their delivery, so you can talk to your midwife about when to have your last top-up.
Might have a sleep now.
Yeah, no, absolutely.
Catch up with some reading, some rest. Yeah. Do some texting.
If you need an epidural, the anaesthetist will do their best to come to you as quickly as possible. However, the delivery suite can be very busy, and you may need to wait a short while until the anaesthetist is free. Who can and cannot have an epidural? Most women can have an epidural, but certain medical problems may mean it is not suitable for you. For example, women with previous back operations, spinal cord and brain problems, or problems with blood clotting may not be able to have an epidural, but safe alternatives are available. If you are overweight, it may be more difficult to put your epidural in, and it may take longer. Epidurals are very safe, and lots of women have them every year, but we must also tell you about the small chance of problems. Sometimes epidurals may not work well enough to ease your labour pain completely. If this happens to you, we can try a number of options to help. We can repeat the epidural, or combine the epidural with a spinal to provide faster pain relief. Other problems include a drop in your blood pressure, nausea, and itching. You have a 1 in 100 chance of getting a severe headache after an epidural. This often goes away on its own, but some women need further treatment. The risk of damage to a nerve, which may cause a numb patch on your leg or a weak leg, is 1 in 1,000 to 1 in 13,000. Many women worry about the possibility of paralysis with an epidural, but this is actually extremely rare. Infection or a blood clot in the back is also very uncommon. Another common worry is long-term back pain following an epidural. Backache is common in pregnancy and often continues after delivery of the baby, but it is unlikely to be caused by the epidural.
To keep your pain relief at a certain level. In your legs, the more top-ups you have.
If you need to go to theatre to have your baby, strong painkillers can be injected into your epidural to ensure that you are comfortable throughout delivery. If your epidural has not worked well during labour, the anaesthetist may remove the epidural catheter and give you a spinal injection of pain medicine instead. It is safer for you to have one of these injections rather than a general anaesthetic. The anaesthetist will stay with you all the time during your operation.
Right. So thank you very much. Thank you for listening to me. If you have any questions, please do not hesitate to contact our anesthetic department. We'll be very happy to answer those, and all the best luck. Thank you.
You enjoyed that. I thought that was I've never heard Eve speaking on that subject before, and I thought she did a really good job.
Thanks, Eve.
Yeah.